Today, we're going to build something super important, your own personal user's manual for your health. We're diving into what's called adult health maintenance, which is really just a proactive guide to staying well, catching any issues early, and basically creating a long-term health strategy with your doctor. So let's get right into it. Seriously, think about it for a second. Most of us, right? We only go to the doctor when something is already wrong. We've got a cough we can't shake, a weird pain, you know the drill. But what about going when you feel totally fine? Well, that's where the real magic of preventative medicine happens, and it's what this is all about. And this slide just breaks it down perfectly. A sick visit, that's reactive. You've got a problem, and the doctor helps you fix it. Simple. But a wellness visit, that's proactive. The goal isn't just to solve what's wrong today, but to stop problems from ever starting and to get a big picture view of your health. So let's dig into what these preventative visits are really all about, because trust me, there's so much more than just a quick checkup. This right here is the mission statement. Adult health maintenance is a strategy. It's about looking at your unique risk factors, talking through your daily habits, and then using specific screening tests to catch diseases before you'd even notice any symptoms. It's about playing offense with your health, not defense. You know, one of the most powerful things in a wellness visit happens way before any tests are ordered. It all starts with a simple conversation about you and your life. For instance, your doctor's going to want to chat about what you eat. Are you getting the right nutrients? Maybe you follow a specific plan, like a vegan diet. And look, this isn't about being judged. It's about spotting potential risks for things like low vitamin B12 or iron, and just making sure your diet is setting you up for success. Another huge topic is sun safety. If you have fair skin, or maybe a family history of skin cancer, or you just spend a lot of time outside, this conversation is absolutely crucial. Your doctor can talk you through the best ways to protect your skin. We're talking everything from the right sunscreen to protective clothing. It's all about lowering your risk. And of course, a cornerstone of prevention is immunizations. Are you up to date on your tetanus shot? Did you get your flu shot this year? And depending on your age, what about vaccines for things like shingles or pneumonia? A quick review just makes sure you've got all the protection you need against diseases we can actually prevent. Okay, let's move on to a really critical part of these visits, screening for major cancers. This is where early detection can literally be a lifesaver. This table does a great job of simplifying some pretty complex guidelines, but the main point is so important. Just look at the different starting ages and how often these tests are done. The whole reason we do this is because finding these cancers early just dramatically changes everything. For colorectal cancer, which we now screen for starting at 45, finding it early can mean a 90% survival rate. For women, cervical screening starts at 21 and mammograms at 40, because that's when treatment is most effective. And for people with a heavy smoking history, those annual lung scans can find cancer at a much, much more treatable stage. Now, of course, these are general guidelines, and your doctor will help you figure out the exact plan that's right for you. But it's not all about cancer screening. The wellness visit is also a vital chance to take a holistic, wide-angle look at your physical and your mental health. This simple question, it's surprisingly powerful, isn't it? It's an invitation to talk about stuff beyond just physical symptoms, like stress, your mood, how you're sleeping, your overall sense of well-being. Your mental health is every bit as important as your physical health. And to help with that conversation, doctors do routine psychosocial screenings. They'll ask about things like tobacco, alcohol, and drug use. And they'll often use simple questionnaires to screen for really common conditions like depression and, for adults under 65, anxiety. Catching these things early is always the first step toward getting the support and treatment that works. And you know, your health isn't just about how you feel. It's also about the numbers. Routinely checking your blood pressure, cholesterol, and blood sugar, it creates your own personal baseline. Tracking these key numbers over time is what lets you and your doctor spot trends and catch silent problems like high blood pressure or pre-diabetes before they turn into something serious. Okay, now for the payoff. All of this info, your age, your sex, your risk factors, it all comes together to create your very own personalized health timeline. So let's take a look at what that might look like. For women, this screening journey really evolves through different stages of life. It starts pretty early, with cervical cancer screening at 21. Then, because our metabolic risks can change, diabetes screening usually begins around 35. The 40s are a really key decade, kicking off screening for both breast cancer at 40 and colorectal cancer at 45. And then later on, at 65, the focus expands to include bone health with osteoporosis screening, which is all about ensuring strength and preventing fractures. For men, the timeline has its own set of crucial milestones. So diabetes and colorectal screenings start at the same ages, 35 and 45. At 45, it's also time to have a really informed conversation about the pros and cons of prostate cancer screening. For anyone with a smoking history, lung cancer screening at 50 is critical. And then at 65, there's a one-time screening for something called an abdominal aortic aneurysm. That's a dangerous swelling of the body's main artery, and it's specifically recommended for men who have ever smoked. So there you have it. You've got the user's manual. You understand the what and the when. But the last, and honestly the most important step, is recognizing your own role in all of this. This is really the ultimate takeaway. Your doctor is the expert on medicine, for sure, but you are the expert on you. This whole process only works if it's a partnership. Being engaged, asking questions, sharing what's on your mind, those are the most powerful things you can possibly do for your long-term health. So I'm going to leave you with this final thought. Based on everything we've just talked about, what's one question you're going to ask at your next wellness visit? Whether it's about a specific screening, a lifestyle change you're thinking about, or a concern about your family history, just having that question ready is the first step to being your own best health advocate. Thanks for tuning in.